Hi, I'm Ron Hamill, Senior Ethicist with the Catholic Health Association. Welcome to CHA's educational resource to help those working in the Catholic health ministry to better understand and apply the ethical and religious directives for Catholic healthcare services. CHA has developed this resource to provide an accessible and convenient way to learn more about the directives and how you can use them to address ethical issues that you or your colleagues may face. The directives provide guiding principles so that we always safeguard and promote the dignity of the human person in delivering our care. They're designed to help physicians, other healthcare professionals, and all who work in Catholic healthcare to carry on the healing ministry of Jesus in a manner consistent with the identity of Catholic healthcare and the moral teaching of the Church. The directives were developed by the United States Conference of Catholic Bishops in consultation with bishops and theologians, sponsors, administrators, physicians, and other healthcare providers. Periodically, the directives are reviewed by the Bishops' Conference to address new insights and issues that impact the Catholic health ministry. This module caters both to individual and small group learning. You may participate at your own pace, in one sitting or in separate visits, depending on your schedule. The module contains an introduction to the ERDs, along with 6 individual segments that correspond to each of the 6 parts of the ethical and religious directives. Each part begins with an introductory video that features leaders in Catholic healthcare who share their insights and experience with particular directives. After the video, you can learn more about how the directives apply by reviewing case study examples in the supporting materials for each part of the video. These materials also include answer keys for the cases, discussion questions, a bibliography with additional resources, prayers, and a facilitator guide for group learning and interaction. To make your learning experience as rewarding and productive as possible, we recommend you read the directives first. The directives can be accessed through the United States Conference of Catholic Bishops, or can likely be obtained within your own institution. Now, we invite you to watch the introductory video for an overview of the directives and their importance for the Catholic healthcare ministry.
I think the ethical and religious directives are a very much underappreciated document. For some reason, people have this belief that it's this long, technical, complex, theological treatise, and it really isn't.
We truly believe that what we're doing is the work of God, is an extension of the gospel and the ministry and the mission of Jesus Christ. So that's how the ethical and religious directives came to be.
Physicians should read the directives because I think it really kind of reinforces this is why we're doing what we're doing.
I think ERDs are probably one of those hidden treasures that most of the physicians are not aware of.
It re-enhances what you're already practicing in day-to-day hospital and office care.
I think the ERDs are our way of saying, we're with you. We appreciate what you're trying to do. We know you take extremely seriously what you're doing, and we're here with you to provide the moral framework, the ethical reflections, so that you can do that with a peace of mind, a peace of conscience, a realization this really is the healing of God.
Today, Catholic hospitals, nursing facilities, and other health organizations are continuing the healing ministry of Jesus within the complex, ever-changing world of 21st century healthcare. The ethical and religious directives for Catholic healthcare services, developed by the bishops of the United States in consultation with Catholic health providers, offer assistance and guidance to the people who serve in these Catholic health organizations.
Healthcare has changed so tremendously in the past 40 or 50 years that we need some kind of guidance to help us to reflect about what we understand as far as the meaning of life, suffering, sickness, death, birth. And the directives are intended by the bishops to be a guideline to help us with that, to assist those persons within Catholic healthcare as well as patients and family members to make the difficult kinds of decisions that they make.
These ethical and religious directives describe healthcare that is consistent with the values, beliefs, and commitments of Catholic faith.
When you open the directives, it's a mini course on Catholic identity in the world of caring for others. The ERDs help us, first of all, restate our identity. Then they help us with practical guidelines in living out that identity. And then they remind us that we're structured, we're visible, we're all part of a structured, visible church.
What the ethical and religious directives are doing is very succinctly saying what it means to be part of a Catholic ministry. But if you take a look at that, it's not simply Catholic ministry. They're saying in a rather succinct way, what are the values of the medical profession itself?
And each section of the directives begins with pretty much a theological background from where are these directives coming from. And I always find those theological background to be so helpful and so focusing.
Grounded in these normative principles, the ethical and religious directives are organized in 6 chapters or parts. Part 1 addresses the social responsibility of Catholic healthcare organizations, including the ministry's special concern for persons who are poor and vulnerable.
In Part 1 of the directives, in the section that is referred to sometimes as the normative principles, the document clearly tells us that Catholic healthcare should have a deep and profound commitment to caring for the poor. And this compels us as Catholic healthcare to do 2 things. Not simply to serve the poor who come to our doors, but to seek out those persons who are poor and to try to assess their needs and to address the needs. Secondly, and this is quite important and it's addressed in the directives, we make a commitment to advocate for persons who are poor and vulnerable, for persons who are unable to speak for themselves.
We're about healing. We're about preserving human dignity, human life. We're about making things whole and good. That comes right up out of who we are, and the norms come up out of who we are.
The dignity of the person is the cornerstone of the ethical and religious directives, and that the purpose of the directives is to articulate certain norms that flow from the dignity of the person, that protect the dignity of the person, that promote the dignity of the person.
You want to try to help those that can't help themselves. And in doing so, you're doing exactly what you're supposed to be doing. You're doing exactly what Jesus tells us to do, and you're fulfilling that mission.
The care provided in Catholic health organizations goes beyond the treatment of physical disease or injury, recognizing also the psychological, social, and spiritual dimensions of the human person. Part 2 of the directives addresses this holistic vision with attention to the pastoral and spiritual responsibility of Catholic healthcare.
The Catholic Church looks at healing as involving the whole person. There is not just the physical dimension, but there's the whole spiritual, human dimension of life.
The pastoral care department or the chaplain is there to really assist the doctor in trying to name the emotional needs and the spiritual needs of the patient. Oftentimes it's the chaplain in conversation with the patient and family is able to bring to the discussion what those unique spiritual emotional needs are. As one doctor said, I look for the chaplain to really put a face and a story to the person being treated.
When patients come to a Catholic healthcare system facility, they come because they have a certain expectation They have a belief in their morals, and they want to make sure that, or they want to feel that the people that are providing the care have a lot of those same morals and beliefs.
Many of our patients have chosen us because of our religious affiliation. Many of our patients, if not all, value a religious aspect to their life.
Many physicians work in Catholic healthcare facilities who are not Catholic precisely because they find something there that they can't find in the other institutions.
Part 3 of the directives describes the nature of the relationship between patients and the physicians, nurses, therapists, and others who provide care.
My relationship with my patients is sacred. I'm allowed to touch people and to ask them questions about things that no one else is allowed to do, not even members of their own family sometimes. And that kind of a trust and bond works best if you remember that it's sacred.
You take care of a person, you're taking care of a patient, you're not taking care of a disease, you're not taking care of a lab number, any of those things. And along with that, you acknowledge their families, because their families are very important in their care. All of that adds to the dignity of the patient.
Respect for human dignity is central to Part 4 of the directives, which deals with issues in care for the beginning of life.
Respect for the dignity of the person and the sanctity of life underlie all of the directives. In Part 4, we see that belief combined with the role of marriage and the meanings of the marital act, and it really does give us good guidance.
The ethical and religious directives inform Catholic health care as to the importance that the Church places upon human life and the sanctity of human life, as well as relationships.
Like care at the beginning of life, care provided to those at the end of their lives must also be grounded in reverence for human dignity. Part 5 of the directives treats issues in care for the dying.
It is often a moment of acceptance of the fact that death is a part of life, and a recognition that as Christians we believe that this life is not all that we live, but that it is an affirmation of the life to come, and a recognition that the person needs to spiritually prepare for facing his or her God and Creator.
Death is inevitable for all of us, and so we have to be able to effectively deal with patients who are in the dying process. We have to allow them to share in the decisions that are being made about this process for them.
Catholic health organizations are caring for persons from life's beginning until its end. They carry on the ministry of healing while confronting contemporary business and ethical challenges. Part 6 of the directives explores the issues facing the ministry when forming new partnerships with healthcare organizations and providers.
We have to engage people and others that we may not have had a close relationship in our care delivery models, and that's physicians, and it's home health care agencies, and it's long-term care agencies, and so on, and they're not all going to be Catholic. There's no way that they can do that. So I think that the ERDs give us some guidelines of how we should approach those partnerships.
The beauty is in challenging us to create partnerships so that we respond to the needs of our society and the needs of those in our community, that we create partnerships about the more, that we create partnerships to treat those who are on the margins, those who are poor, those who are the 48 million or however many million of uninsured that we have in our day. You know, it's just plain unjust.
The directives are there to ensure that as we go about the business of healthcare, we're also always involved in the ministry of healthcare.
Taken together, the ethical and religious directives are a rich, affirming resource for the people who serve in the Catholic health ministry. Far from a mere set of rules, the directives present a vision of true healing.
They are intended to be a framework to help us to really live out the commitment that we have made with a sense of integrity so that we can continue to carry on the healing ministry of Jesus.
What they try to do is to take what is the obligation of any human being, and particularly any Christian human being, to be able to relieve the suffering of the vulnerable and the sick.
When you open the directives, it's a mini course on Catholic identity in the world of caring for others, health care of others. The ERDs help us, first of all, restate our identity. Then they help us with practical guidelines in living out that identity. And then they remind us we're all part of a structured, visible church.
The directives invite us to be fully what we can become and to desire to become as Catholic healthcare providers.